Hello, everyone. This is Dr. Nushin Darvish, and I am here live from Holistic Naturopathic Medical Center. And we are talking about menopause. I'm hoping that Dr. Marian will be joining us soon. So I wanted to, first of all, discuss the whole idea of why we need to be talking about this. Because women have a very special distinction in the world and our role in this world. And so we have been given the capacity to be complementary to the masculine energies that are continuously around us and have dominated this world for centuries. So I think it is time for us to arise, guys, ladies, into being more balanced and bringing that balance of femininity into this world of masculinity. So I see that we have the capacity to be nurturing, to be deeply loving, these capacities of being at one with others, the empathic and the empathetic and compassionate role that we have as educators for both boys and girls. So it's a very, very powerful time to be in right now, because we have the capacity to learn and grow and transform ourselves. And this means that it is truly an honor and a blessing to be a woman at this time. So I'm so excited to be talking about menopause and perimenopause, as this is something that every woman has to go through, that we all have to transition. So my goal as a physician and as a woman is to accompany every other woman in their journey through well-being and learning. And we have the capacity to arise to this divinely established station for us women. So to do that, though, we have to be really conscious. We have to have conscious effort in the way we think, in the way we behave, in the way we feel, and our physical well-being as well. So we have to elevate all of these parts of our well-being into a much higher level at every moment in order to be able to transition through menopause. And so I was doing a little bit of research just before this, and I discovered that there is 1.2 billion women worldwide with that are menopausal and will be menopausal or postmenopausal by the year 2030. 1.2 billion women. I mean, that's mind-boggling. That's absolutely mind-boggling. And then furthermore, they were saying that 47 million women enter menopause every year. And about 85% of all the women do experience some kind of symptoms and hormonal symptoms. So I'm waiting for Dr. Marian to join us, and I think she's about to join us. She is going live. Here she is live on Facebook, and hi, Dr. Marian. Can you hear me? I don't know if she can hear me yet. I'm not sure if she can hear me.
Hi.
And so hopefully she will go on Instagram live in just a few minutes. Hi.
Yes,
I cannot hear you. You're not.
Can you not hear me?
Perfect. So we can hear each other. I can hear you now, but I cannot see you on Instagram. I can only see you on Facebook.
Maybe it's. You can hear me?
I can hear you, but I'm not seeing you on Facebook.
You have to accept the request.
I'm not seeing a request. That's the problem.
To join.
I'm not seeing. Oh, there it is. No, there. Yeah, I'm not seeing the request to join. Isn't that funny?
I sent it. Oh, wait, here, I can do it. It's right here. Oh.
Okay, I'm having some assistance here. Okay, so now you should be coming on Instagram in just a second. Perfect. Hello. Hi, Dr.
I think there's
Marian.
a little bit of a delay. Is it still? No, that's working. Okay.
It's working. It's working good. So
Okay.
I was just starting off talking about how important our role as women are in this world, and the transitions that we make from perimenopause and menopause. And the beauty of today's conversation actually is that we have two generations before you. One is Dr. Marian, who is a millennial and is entering perimenopause. I think so. And then there is me, that I'm a Gen X and going through menopause. So it's we're going to kind of have an experiential discussion about two generations going through this process, and its importance in evolving as females, and the importance we have as role models for establishing a much more peaceful world in our society. So I was going to start with discussing the definitions of perimenopause, menopause, and postmenopause. The funny thing is that I was talking to my husband in the car this morning. I said, "What's your definition of menopause?" And he said, "When women are in full rage." Hormonal rage. I'm like, "Thank you very much."
I'm just going to close the door really quick.
Okay. So menopause is really when females are going through a stage of 12 months of having actually no periods, no cycles. And it's a period where the cycles are, the menstruation and the ovulation is going into cessation. And as a result, there's a drop of hormones of progesterone and estrogen. Perimenopause is when the time before that, right? Mm-hmm. So, and that can start as early as in their 30s. Women, we can start as early in our 30s and go through cycle changes and hormone shifts that come and go, and there's no definity of the cycles sometimes, and that's the perimenopause. So menopause is the time after that when there's no period for at least 12 months. And then postmenopause is when after the 12 months. So that's called the postmenopausal period of time. Right?
Yes. Yeah.
So do you have any comments to make about that? About maybe we should start talking about perimenopause a little bit, Doc, because you're going through that stage of your life at 30 and up. Where you get to my stage.
Well, yes, perimenopause begins with stage 2 of the transition phase. It ends with 12 months of amenorrhea. So I'm not sure exactly. Is stage 2 defined as in the 30s or?
Well, it could be 30s, it could be 40s. I mean, it's different for every woman, right? And it's different in terms of what experiences you have gone through. So some women will have an abrupt cessation of their cycle because they've gone through hysterectomy, and usually a full hysterectomy where their ovaries have been removed, or they're going through some kind of chemoradiation that blocks the ovulation and the hormone production. And so they go into menopause during that period of time. So in other words, they're going into the 12-week or 12-month of having no period.
Yeah.
And they may experience symptoms of hot flashes or irregular menses or insomnia, sleep issues, joint pain, mood swings, depression, anxiety. I mean, the list just really goes on. Brain fog, weight gain, right? All of those things that you have to look forward to, Dr. Marian.
Yeah, so I have on average the perimenopause lasts about 4 years, and about 90% of women go through menopause between the ages of 45 to 55, with the majority of them experiencing it at about age 50 to 52.
That's right. But I have also found records showing, and from experience showing, that menopause or perimenopausal can take 10 to 15 years, an average of 7 years. So you could have swings going on in your hormones and the bloating and palpitations and libido shifts, anxiety, depression. And that's really important to recognize, because how many women have depression and anxiety, and then they go to their primary care doctor and they're put on some kind of an antidepressant and an anti-anxiety pill, right? And instead of having their hormones evaluated and supporting them. And that's really one of the things I want to really concentrate on, focus on, is that menopause and perimenopause is not a disease. It's not something that needs to be treated. It is something that needs to be supported. And so often we have, up to this point anyways in history, we've thought of menopause as a disease that we need to treat, but it's not like that. And this is one of the things that we're going to be talking about, is how do we support women, ourselves and each other, in going through this process of transitioning into this whole new flower.
Yes, I love that.
Because it really is a transition. It's really a flower that is trying to blossom. And I think we spent more than a third of our lives without a cycle, right, on the average. So it's only about a third of our lifetime as females that we have fertility and cycling and hormone cycling and menstruation. But after that, and before that, there is not much going on in terms of cycles. And yet it is a time where we are looking back and recognizing the old things that we need to let go of, whether that is physical, mental, emotional, the stories that we need to let go of, the trauma that we may need to let go of, the relationships that we may need to let go of, the jobs and careers. It's really coming to a closure, the closing of a chapter, and opening a doorway to a much bigger, wider opportunity of life. I was actually talking about this with a couple of my patients this morning as we were discussing menopause and the process of menopause, and how, the spiritual, energetic world has no time. The physical world has a time. And so we're so focused on age in this world. How old are you? How close am I to menopause? And when is menopause going to happen? And all of that. And yet the spiritual and energetic world already knows where you are, where you're going to be. And so our job is to really tap into that spiritual, energetic forces to recognize what we need to be doing and where we need to be going, because it's already happened. It's already there. It's already existing.
Yeah.
Right?
I like that. That's beautiful.
So, but the process is, how do we get there? How do we connect? How do we tap into that spiritual recognition and realization? And the beauty of learning and experiencing menopause is, and perimenopause, is that it gives us an opportunity to really look at mindfulness, to look at how we are being and acting and going through this process, and giving us an opportunity to do yoga and meditation and prayer, to tap into these energies, to recognize what is in the basket, what is in the cup for us, right? So that we are not so stressed about it when we're going through this process.
Yeah, absolutely.
So let's talk about some of the symptoms of perimenopause or menopause. What have you experienced with your patients, Dr. Marian, or yourself, or what would you like to share?
Yeah, so the big one is, of course, a stopping of your menstrual cycle. And again, menopause is defined as 12 months of no menstrual cycle. So even after your period has stopped, you can go through 3 to 6 months where you're not technically in menopausal period yet, but that's the biggest symptom. And then we also see patients experiencing, I'm just getting a little bit of feedback, sorry, I'm just going to turn the volume down. So we often see vasomotor symptoms, including hot flashes, sweating, night sweats, as well as headaches and migraines. And many of the women that have headaches and migraines during the menopausal transition are often the same women that have them during their premenstrual syndrome picture premenopausally. So if you are typically one that gets migraines around your menstrual cycle, that might be something that you experience in menopause as well. There's also psychological and mental health changes such as depression, nervousness, insomnia, decreased libido, and cognitive decline. And a lot of those are due to the drop in estrogen that happens. And then vaginal changes like vaginal atrophy, which is a breakdown of the vaginal tissue. And that is because estrogen plays a really big role in connective tissue integrity. And so when there is a drop of estrogen, there's a breakdown of tissues. And you can see that in the vaginal tissue as well as in women's skin.
So Dr. Marian, sorry to interrupt you, but there is an echo.
Are you getting that as well?
No, I'm not hearing it, but one of the listeners is hearing it on Instagram. So did you try and turn down your Instagram phone all the way to, if you want?
It's the one that has the micro. Well, yeah, I can do that. Let me see if that works. Hold on.
Yeah, I think that might work.
Okay. And then I might not be able to hear you though. Can you hear it now?
No, that's worse.
Yeah.
Now I can hear really the echo. Let's see. Sorry about technical issues. That's better to me. That's better to me. Listeners on Instagram, if you're still hearing the echo, please let us know. Okay, yes. So migraines and vaginal dryness, all of that is really because of drops in estrogen. But the interesting thing is that progesterone actually drops first.
Sorry, I gotta turn the volume up a little bit because otherwise I can't hear you.
Okay.
So hopefully that works. Okay, what was the last thing you said?
I was saying that the main reason that the migraines happen premenstrually, or there's vaginal dryness or skin starting to sag, those are all because of drops in estrogen.
Mm-hmm, exactly.
Right. And so, but the interesting thing is that progesterone is the first hormone to drop premenstrually or perimenopausally, is what goes down first. So a lot of the symptoms that we may experience during perimenopause or even menopause initially is because of the drop in progesterone. And progesterone is really important for bone health. It's really important for brain health and heart health. And it is important for keeping our mood balanced, right? So that's one of the issues, is the estrogen and the progesterone drop.
Yeah, so just a few additional symptoms that we see in menopause, urinary tract issues. So you also may see urogenital atrophy. So you might have urinary tract infection-like symptoms without a urinary tract infection, as well as nocturia, so urinating at night. And then confusion and short-term memory loss we often see with patients.
Do you see me like that on Instagram and Facebook sometimes?
Technology is technology.
It's called brain fog, Dr. Marian. It's called brain fog. It's called brain fog, right? And I'm sure many of us, females and men, have experienced this brain fog that is related to hormone changes. I call it pregnancy brain as well, because you get that brain fog postpartum really intensely and during pregnancy, especially during the last part of pregnancy. But postpartum, I remember just having, oh my gosh, I cannot think. And unfortunately, some of that comes up again as you're going through menopause. So see all the good things you have to look forward to, doctor?
Well, as long as you have a good naturopath on board, which most of us naturopaths do, you might get through it a little bit more smoothly.
Exactly. And that's the whole point of why we're having this discussion, right?
Yeah. Yes. Fatigue and weight gain also being important ones. And then osteoporosis and fractures, because estrogen's very important in bone density. So controlling for that is important. And then, of course, cardiovascular disease and synthetic hormone replacement therapy will actually increase the risk of coronary artery disease. Bioidentical hormones do not. And then you also see atrophy of glandular tissue in the breast replaced with adipose tissue. So again, atrophy is a degradation of the tissues, and that gets replaced by fat, which is adipose tissue.
Which is really interesting because as the ovaries stop producing estrogen, the good estrogens really, then the transition goes to the fat cells making some estrogen, and it's more of what we talked about last week is estrone, which is the more toxic and more cancer-causing estrogen, and hence we see more postmenopausally an increased risk for cancers because that are hormone related because of the estrogens changing shifts. And so that makes it very important for us to manage our weight, our fat versus muscle ratio. So it's not so much a weight management, it's a body composition management. And I really want to emphasize that because people can be really large, but they have a lot of muscle compared to their fat. And then they can be very, very skinny. And we call that skinny fat, where they're very skinny and they have a lot of fat, but you can't really tell. You think they've got muscle, but it's actually a lot of fat compared to the muscle. And they have just as high of a risk for hormone-related cancers, which, by the way, include colon cancer, breast cancer, ovarian cancer, uterine cancer, brain cancer, and lung cancer. So those are all hormone-related cancers. And there's so much we can do to reduce our risks for that. And it really starts young, right? It really starts even before menarche, before you have your period. But if you miss that period and you have a, not so great of a lifestyle in terms of diet and exercise when you were young, then you have the opportunity to do that in your 20s and in your 30s, and then 40s and 50s and 60s to continue, and 70s to continue maintaining that muscle mass that is so important in creating much more health with us. I always think of the muscle mass as having more oxygen. Right? It's red, more oxygen, more vitality, more energy, and less toxins. Whereas when you think about fat is kind of dead tissue to me. It's white. I always think of the image of the chicken fat comes to me, right? There's nothing there. There's no blood vessels, no nerves, no nothing there. It's just fat that is yucky and it's producing a lot of toxins. And so we really need to work on shifting the body composition to help ourselves be more healthier. So that includes exercise, especially weight-bearing exercises, lifting light weights or doing jumping jacks or running, anything that uses gravity to pull the weight down towards the ground, and you have to resist it. Right. So any kind of a resistant exercise is going to be really beneficial because it's stimulating bone as well as muscle mass production during and before this menopausal time and afterwards.
Yeah, exactly. Yeah, muscle has, especially the quads have the most insulin receptors of any part of the body. So if you really work on strengthening the quadriceps muscles, you have the best chance of reducing insulin resistance and making sure that blood sugar is staying regulated.
Yes, and there are studies showing how the biggest muscle in the body, which is the quads, the stronger that muscle is, the more powerful the mind is, the brain is, and the less risk for memory loss and Alzheimer's. So strengthening those quads. Do your squats, girls. Do your squats. No matter what age you are, do those squats. So diet, let's talk a little bit about diet and what kind of a diet is most beneficial for a perimenopausal, menopausal, or postmenopausal woman.
Yeah, so diet is one of the most fundamental naturopathic interventions because it really isn't something that you have to take. It's just a lifestyle modification that you would use to optimize hormones. And as far as fats go, we want to decrease saturated fat and animal fat. And you only want to use hormone-free meat and dairy, cheese, and eggs. And then increasing cholesterol levels occur in postmenopause. And so we're mindful of the amounts of intake. And then carbohydrates, we want to make sure that the patient is following a low glycemic diet, and that is to make sure that the insulin receptors are sensitive and that blood sugar is being regulated. And then we recommend at least 25 grams of fiber a day, but I would say that's on the low end. Probably upwards of 40 to 50 grams of fiber a day would be optimal. And then focusing on low pesticide exposure. So organic vegetables versus non-organic. Definitely, if you are consuming grains, then making sure that those are organic, because that is a source of pesticides, which are xenoestrogens.
Mm-hmm.
And then phytoestrogenic foods can be helpful. So soy foods that are clean and not GMO and not with a lot of pesticides can be good, as well as almonds, alfalfa sprouts as well. And generally you want to go moderate on salt, not too heavy and not too low. And actually increasing cold drinks and avoiding spicy foods can help with addressing hot flashes and night sweats.
So I'm going to go further than that, Doc Marian. I'm a little bit of a hardcore in certain things, and one of the things is being on a vegetarian diet. The research has shown that a vegetarian or even more of a vegan diet is much more beneficial to balancing those hormones than an animal-based diet. So all the keto diet, all the paleo diet that's out there that is focusing on increasing animal and animal fat is actually counterproductive to hormone balancing, to insulin balancing, and to ultimately helping with weight management and mood swings and hot flashes and insomnia and all of those symptoms that as women we go through, an osteoporosis, right? So it's counterproductive to those symptoms and conditions, specifically in women. So I don't think ketogenic diet or paleo diet is a beneficial diet for women. If you are suffering from neurological diseases or cancer, that's a different story, and we will have a talk about that and as to what kind of a diet you should be on. But for just a regular woman going through this transition, I think a vegetarian diet with no meat or very little meat, such as lamb or wild fish or salmon cod, something like that, is going to be much more beneficial. And like you mentioned, soy products like tempeh. My favorite is tempeh because of the amount of protein it provides for us, but at the same time, it has those estrogen balancing properties, right?
Mm-hmm. Yeah.
So interestingly enough, I was looking at some studies as to what kind of treatments reduce hot flashes, to what extent. And one of the studies was looking at hypnosis.
Oh,
and
wow.
that about 5 sessions of hypnosis will decrease hot flashes by 70%.
Wow.
Only five sessions. So this is really an awesome, awesome thing to engage in, is some hypnosis if you're having a lot of hot flashes. The other one is biofeedback therapy, and something that we do often here at Holistique is on-demand biofeedback therapy using bioresonance and pulse electromagnetic frequencies. That has the capacity to reduce menopausal symptoms across the board, whether it's sleep or hot flashes, emotional swings, up to 55% of reduction of these symptoms using biofeedback therapy. And then we found that mindful stress reduction techniques improve symptoms and quality of life and sleep quality just generally across the board. So again, going back to that thought of mindfulness, the way we think, the way we act, the way we serve the world, the way we meditate, all of those kind of mindful lifestyle techniques, including eating habits and exercise, are going to improve the quality of life, reduce symptoms, and improve sleep quality across the board. They also found that yoga has the capacity to help with psychological stress and fatigue, but not so much hot flashes or other symptoms. So that was very, very interesting. I do think that yoga will also help benefit bone health, but they didn't mention that. So they looked at psychological stress and fatigue with yoga, helping, but not the what we call the vasomotor symptom. Right. So that was very fascinating to look at those statistics. Another one was lavender. Now we use lavender quite a bit here at Holistique. Lavender that we use comes from Europe. It's called lavandula, and or Lavella. I'm sorry, the product name is called Lavella, right?
Mm-hmm.
And Lavella is an esterified lavender oil, which basically makes it more absorbable into the nervous system. And so they have found that it does help with anxiety and depression and sleep and hot flashes. So
I
some
didn't know that.
interesting things.
Yeah,
Yeah,
that's interesting.
yeah, some really good information out there. So
Yeah, we use Lavilla a lot for anxiety, and actually it was shown to be as effective as some SSRIs, including Prozac, in a depression trial. So we often use it with our mental emotional patients, which there can be a mental emotional component during menopause. So that's really fascinating.
Yes, and then they also mentioned evening primrose oil, and how evening primrose oil reduces hot flashes and other hormone-related menopausal symptoms by 42% after you use it, for a good 6-week period of time. So you really have to be consistent with some of these things. But going back to this whole idea of why are we even thinking about or talking about this, because of the amount of symptoms and conditions that we go through as we're trying to transition through menopause, is basically why do we need to do this? Why do we need to address this? We're not treating it, but we're supporting it, right? To that effect, again, we're trying to support the hormones. We're trying to support the body processes. And the way I often think of it is that we're, as females, going through this neuroendocrine reset. It's like rebooting your computer or doing your website, right? Making it even better, right? And so we have to kind of figure out what's off and what's not right, and reorganize the whole nervous system, which affects the physical, mental, emotional. I mean, every single system in our body, including our digestion, is affected by these hormones. So people come in here with gas and bloating and heartburn, and that could simply be because of hormone changes that they're experiencing. It's something that I experienced myself, and I had to recognize that it was a hormone thing. It was not necessarily a food thing or an infection thing, but it was actually the amount of stress and hormone reorganization that my body was going through. So I think it's really important to look at the symptoms during this period of time and recognize that hormones play a big role instead of just suppressing and shutting it down. So that means looking at tests, looking and evaluating hormone balance. Would you like to talk a little bit about that, Doc?
Sure. So one of the main tests that we use is the Dutch test, which, Dr. Darvish, do you know what it stands for? It's urine test for...
Dried urine test for comprehensive hormones.
Yes. So in short, we call it the Dutch test. And that helps us to look at estrogen, progesterone, testosterone, DHEA, and cortisol, among a number of other biomarkers. And it's a bit more accurate than what we would get in blood because it's averaged over 4 to 5 urine collections. So whereas testosterone is highest in the morning in most people, it's going to be lower in the afternoon and evening. So your testosterone might actually look normal if you do a blood draw in the morning, but then it could drop significantly and overall average be low. So the Dutch test helps us to identify more accurate hormone levels, as well as B6, B12, a few neurotransmitters, and glutathione. And then it also looks at how estrogen is being metabolized in the body. So it will give you a level for E1, which is estrone, and E2, which is estradiol, and E3, which is estriol, and then numbers for 2, 4, and 16 hydroxy metabolites. Actually, just 2 of those. I forget which 2. But both of those are important because we want to make sure that estrogen is being metabolized down through the least inflammatory and least cancer causing pathway, which we can modulate with a number of herbs and different supplements. So that gives us quite a bit of data to work with as far as where the hormones are at and how we can modify them to be optimized And this is particularly important when we're using bioidentical hormones during menopausal transition periods, because it's important to know exactly where they are to begin with and how much you're giving and at what levels of each of the different kinds.
So there's a question on Facebook about blood testing. Is that accurate? How often should we be testing? So would you like to answer that question as well, Doc?
Yeah, so I would say it's not as accurate. Blood testing is not as accurate as the urine test that we use, which is the Dutch test. And again, a blood draw is just one snapshot. It's that very moment when the blood was drawn. But throughout the day, hormones fluctuate. And so averaging over 4 to 5 different urine collections gives us a bit more accurate read. And what was the second part of the question?
How often should a postmenopausal woman get tested?
So usually we do the Dutch test once a year, especially if a woman is using bioidentical hormones for replacement. And we may do that more often if we need to get more information as far as adjusting dosages or making sure things are metabolizing appropriately. But usually about once a year for the Dutch test. Probably if you are going with more of a blood work approach, it needs to be done more often because it's just not as accurate.
Yes, and what I see is actually a little bit danger in prescribing hormones just solely on blood work, because the way I think of it is that what we see in blood is what's circulating and not what's at the tissue level. And if you think about where cancer begins at the tissue level. And so if you're just looking at what's circulating and not recognizing what's at the tissue level, you can be overprescribing certain hormones. And I have seen women be overprescribed some of these hormones, and that can be just as dangerous as not having some of these hormones. So that's one of the other reasons we go with Dutch. We often do thermography in conjunction with the Dutch test, because again, it gives us an inflammatory evaluation of what's going on, let's say at the tissue level in the breast tissue, where it has high levels of estrogen receptors. And so if you're only treating based on blood, you're missing out the changes that can be happening at the breast level or the tissue level and causing more cancer. So I like looking at the Dutch as well, Doc, and doing the thermography along with it. So the other question is about how do we tap into our spiritual energy that's coming on Instagram, and that's a whole talk on itself. But one of the techniques that I like is, at the end of the day, we are spiritual beings. At the end of the day, we are spiritual in our essence. We are souls that are experiencing the world through this physical body, this temple. And I call this temple the temple of the soul. It has the capacity to help us achieve our spiritual well-being. And so it's just as important to attend to our physical body as it is to our spiritual body, right? And I'll be curious to see what kind of things you do, Dr. Marian. But for me, I think that meditation and prayer and service to others is a very powerful way of tapping into our spiritual energies and recognizing that, first of all, recognizing that we are spiritual in essence, really, and then connecting to that through meditation. And the way I meditate is not necessarily just through yoga and putting on meditation tapes, but it is also reading or saying some prayers, and then going in at a peaceful state, going at, trying to shut down the mind, not to think about anything, not to intellectualize anything, but allow the voice within you to tell you things or to give you messages, or allow images to come to you. And that's the way I have learned how to meditate. And that's the way I have been able to access some of the answers to some of the questions and to help myself grow and evolve. And so, yeah, so that's the way I do it. What about you, Doc?
Yeah, actually, this is something that I have thought about quite a bit over the years, because I've gone through periods of really struggling with tapping into my spirituality, and sort of go through phases where I am more biochemical, more engineering, more analytical. And of course, as a physician, we do need to be quite analytical at times and analyze labs and physical exam and so forth. And when I get sort of too far in that direction, I often find myself losing touch and or not feeling quite connected with my spirituality. And so I've tried various things over the years. Meditation is a really big one, or a really important one for me, but I think it's important to find what feels authentic for you. And for many people, they're not there yet with meditation. And so finding where what works for you as far as feels authentic and what feels spiritually connecting for you as an individual. But certainly meditation and as well as altered states of consciousness can be really quite powerful as far as connecting to sort of that realm or that side of oneself. And in various times in the past, I've also been a part of different groups. So it was sort of a shamanic type trans-cultural spirituality group. And so I found that being in community was helpful because you're not just on your own, and there's exercises and group activities and different things to sort of help one develop their own spirituality or their own spiritual identity. And so that at that time for me was helpful. And but right now that's not where I'm at. I don't want to do it in a group setting. I'm more into my own individual practice. So I think that can also flux with where you're at in life and where you're at with your spirituality.
I completely agree. I think the whole concept of spirituality can be very scary for some people, and some people equate that to religion, versus it's just, I see it more as the soul connecting with our soul, with our spirit. And you may use religious readings, and you may use different communities to help develop your own spirituality, but it's ultimately, like you said, it's very individually driven, and I'm very much for the whole concept of independently investigating the truth for ourselves and learning in conjunction with consultation and discussion with others, because I do think that there is a power to when we come together as a community at times to elevate the spirit, the energies of each of us, and as a whole community. So it is a very powerful way of elevating and recognizing that this body is just a vehicle. And I find that it works to help me resolve some of my physical menopausal symptoms when I'm meditating, or when I am serving, helping others, and doing volunteer work, or giving, or just making a meal for somebody, or just loving somebody, and just expressing love and giving. That in itself, done in a conscious of mentality of service, can shift our physical expression of symptoms. And so we can overcome some of these symptoms of menopause, whether it's hot flashes or sleep issues or anxiety and depression, by forcing ourselves to get to that level of spiritual elevation. And it is pretty scary for some people when you say meditate. People are like, I can't meditate, I can't calm down my mind. And it's okay. Most of us have those days. Even the most expert meditators have days and times when they cannot meditate, but it just takes that step to just say, okay, I'm going to sit down and be quiet, try to quieten my mind for 30 seconds, then push it to 60 seconds the next time, and then a minute. And before you know it, and maybe even 2 hours that you're meditating, and the time has gone by and you don't even recognize it. And there are apps out there, right? There are apps like Calm and Headspace. There's many apps out there that kind of teach you the process of meditation. But I think it is one of the most vital techniques that, as women and as perimenopausal and menopausal and postmenopausal women, we can use to help ourselves, and also to elevate our relationships, which is also very, very important. During menopause or perimenopause or postmenopausally, just all those hormone shift times, is when we feel like the relationships are going downhill, that there's chaos within ourselves and within our relationships. And really to recognize that we have the capacity to shift the way we are interacting with others so that they interact differently with us as well. And it's all dependent on us as individuals to look at ourselves and to elevate our own well-being spiritually. So I hope that answers that question. But I also want to talk a little bit back on Earth, back to this physical body, of ozone therapies and peptides being a great treatment for balancing hormones. And so it's not all about just bioidentical hormone therapy. Ozone, which is O3. And Dr. Marian, you want to expand on ozone a little bit?
Yeah, so ozone is one of my favorite topics, of course, but it's 3 oxygen atoms, which means a single unit, in one molecule. So the oxygen that we breathe is 21% O2, so 2 oxygen atoms. But ozone is 3, and we use 100% ozone gas for various treatments. But when the ozone goes into the blood or into an area, sometimes we do it in the ear or in the sinuses or vaginally or rectally, the oxygen atoms break apart and they basically create reactive oxygen species. And what that means is that they're just a little bit more bioactive than the molecule itself, because as an individual atom, it has a charge. And so it has the ability to create change in the body, and really helpful for infections and different things, because that's essentially how our immune system kills off different things like viruses and bacteria. Hormonally, I think Dr. Darvish, you might be a little bit better at explaining the interaction between those two, between hormones and ozone.
Well, every cell needs oxygen. That's the way I see it, right? Every cell needs oxygen. Every cell cannot survive without oxygen. And so part of the whole hormone production, just going back to the basics, needs oxygen to create the hormones appropriately. And when we're lacking oxygen, tissue gets into disease mode. Right. And so if we can give the tissues oxygenation, then the tissues start regenerating and healing and improving. So, and balancing itself out. So ozone is one of those things that the biochemical process of how it actually shifts hormones is still not known. But what we know is that it does ultimately shift the balance, or shift the hormones into more balance, both the insulin, the estrogen, progesterone, testosterone, all of the hormones, most likely by regenerating the cells, whether it's in the brain tissue, the pituitary, hypothalamus, the thyroid, the adrenals, whatever tissue it is. But the actual biochemical process is still under investigation.
Yeah, I was just going to say, we often see hypopituitarism, which means low pituitary hormone production, after traumatic brain injury, so after a concussion. And that's because when you do experience a concussion, you will have a lack of blood flow to a certain part of the brain, or a certain part of the brain, and that can cause degradation or damaging of the tissues. And then over time, you might see lower hormone production across the board. So all hormones are decreased. But if we can increase the oxygenation to that tissue, we can then increase the functioning of that tissue. So increase the functioning of the hypothalamus and of the pituitary gland. Sometimes we'll use the hyperbaric oxygen chamber for that. And other times we might use intravenous ozone. But either way, we're increasing oxygenation to the tissues, which can then restore hormone production. And that's really important, of course, for somebody in their 30s or even younger that is hoping to be pregnant at some point in their life. They're going to need their hormones. And if there's been a history of traumatic brain injury, sometimes you have to get the brain and the hormones back on board in order to get things cycling again.
Yeah, and traumatic brain injury could be as mild as hitting the ball in soccer, or having a very mild car accident where you bump your head, or you get the car, the trunk door hitting your head, or garage door or something, right? We've had, most of us have had that, and we don't realize that there is a little trauma that happens to the brain and reorganizes or destroys or causes a dysfunction. in the hormone production. So oxygenation is really, really vital. And I love the oxygenation. I'm glad you brought up hyperbaric therapy because it's one of my favorite things to do for skin. Right?
Yes.
we cannot, or we need to talk about skin when it comes to menopause, right?
Yeah.
Or perimenopause, because we do see more wrinkles and degeneration of the tissue. And this is all about regenerating the cells. And oxygen, again, is a fantastic way of regenerating. So we'll use hyperbaric therapies. We'll do ozone injections very superficially into the skin. We will do PRP, which is your own platelets and your own growth factors from your blood. Mix it with ozone, maybe mix it with some peptides, which are amino acids that regenerate, and do some work on the skin, or for sexual health, because that is another issue that happens with women, is a disruption in their sexual well-being. And hormone therapy is really, really important, but so is ozone therapy, so is peptide therapy. So we don't necessarily have to use hormones to balance some of these menopausal symptoms or help the body regenerate. These treatments can be very, very powerful in regenerating the tissues and keep you feeling mentally, emotionally, and physically younger. And that is my deal. Is I refuse to age, Doc. I refuse to age. So I'm constantly on the mission of figuring out what can we do to reduce or stop or slow down the aging process.
Yeah. Yeah, it's the ultimate dream, right?
It's the ultimate dream for all of us. So keeping those things in mind is very, very important, as well as some things like homeopathy and acupuncture are very, very powerful treatments. Vitamin E is a fantastic nutrient for balancing the hot flashes, as well as helping reduce hormone-related cancers. It's a super duper antioxidant, but you do want to make sure that it's a mixed tocopherol, mixed balance of the vitamin E. There is a vitamin E extract that we carry here called Tocopure, and it comes from the Innato plant from South America, and it's very, very specific in terms of its balancing effects on the hormones for the breast tissue to reduce the risks. And then we talked about phytoestrogens, soy being one of them, but flaxseed is another one that is so powerful to help balance out the estrogens. And then there's red clover, the stuff that grows as a weed in your lawn. That stuff is actually hormone balancing.
Yes.
Which is powerful. And then maca, that's another one of my favorites, is maca, to help balance the hormones. Mm-hmm. So one of our patients, or one of our listeners from Instagram, is mentioning that they're far away from here. Well, I'm glad you brought that up, because we do telehealth consults, and we have patients from all over the globe, anywhere from China to Africa to Europe, South America, Central America, Canada. We have patients from all over the world that we consult, and we guide you through some of these processes. So you're more than welcome to send our front desk an email, or call the front desk at holistiquehealth.com, or simply just go to our website, holistiquehealth.com, to come up with a time that works for you for a consult with one of us. There's 6 of us doctors here in this Holistic Medical Center in Bellevue, Washington, and we'd love to consult and help you out. We've been doing that, at least I've been doing it for 25 years this year, yay! And we keep on doing that. So it's our mission to help transform lives from within and help each one of us gain a better self as we help gain a better community in a world peacefully. So thank you, Dr. Marian, for joining me. Thank you, everyone out there, all the listeners that have been listening to these podcasts and webinars and Instagram and Facebook Lives. We are very much appreciative of your time, and we hope that this is beneficial to you. We'll see you next week on Instagram and Facebook Live on Thursday noon with Dr. Marian. Take care. Bye-bye.
Bye.
This text so I can